Healthcare systems around the world are changing dramatically. Far more pressure on the value of the dollar, so much potential to do more and to work across the traditional systems of hospital, public health, community care. So our managers today have to be very skillful in managing complex adaptive systems rather than managing facilities or services. Therefore, that requires a new and flexible but capable manager to manage across systems between organisations to get the best out of people to improve healthcare. Population health and public health have been the foundation of improving healthcare in many countries, particularly in developing countries. But as we've managed to conquer or reduce a lot of the communicable diseases, we now need to look at more modern models of care that are focused on chronic care and the modern diseases of developed countries. To do that, we need to look beyond hospitals and beyond community health, and that requires an understanding of how systems work, because essentially what we're doing is trying to develop a system of care that crosses over hospitals, community health and public health to give better outcomes for patients, individuals and populations. Health management needs to be studied and embraced as a profession in its own right, particularly by health professionals, clinicians, doctors, nurses and allied health, because the professional background does not necessarily equip people to be good managers or leaders. So we need people who understand their profession, but we need people who understand the complexity of the system, population health, how to strategically plan for the future, most importantly how to manage health reform and change, which is a continuum that's always happening, and we need people with business skills intertwined with their professional health skills. So issues around teamwork, leadership, communication and how we behave as both individuals and as a group is most important for anyone to be an effective leader or manager. The healthcare workforce and healthcare systems are becoming globalised. So there's a great demand across the world internationally for good health leaders and good health managers. Opportunities exist at all levels in an organisation or in a system, but certainly as directors of services, policy researchers, analysts, and so the scope for people who have taken the trouble and the challenge to understand the global healthcare delivery system are greater than those who only look at their own country's system. So it's important, if you want a good career, to compare your system with the systems operating in other countries and be able to stand in an international group and talk about the differences between health systems.